Aortic dissection. Aortic dissection is a life-threatening condition in which a tear in the inner lining of the aorta allows blood to flow between the layers of the vessel wall, which creates a false lumen. This can lead to rupture, impaired organ perfusion, and death. Peak incidence. Highest incidence in individuals aged 60 to 70 years old, more common in males than females. Aortic dissection is more common in individuals with connective tissue disorders. Pathophysiology. Aortic dissection occurs when there is a tear in the tunica intima layer of the aorta, allowing blood to enter the tunica media and creating a false lumen. The formation of a false lumen allows blood to track between the intima and media layers, compromising blood flow to organs and weakening the structural integrity of the aortic wall. This may lead to progressive dilatation and potential rupture of the aorta. Tears in the tunica intima may result from several risk factors. These risk factors include hypertension, connective tissue disorders, for example Marfan syndrome, trauma, pregnancy, and syphilis. Symptoms of aortic dissection include sudden onset of severe chest pain, typically described as sharp or tearing. It radiates to the back. Shortness of breath, nausea and vomiting, syncope, and peripheral limb weakness due to reduced perfusion. Signs: weak peripheral pulses, blood pressure discrepancy between arms, aortic regurgitation, muffled heart sounds suggestive of cardiac tamponade, neurological deficits due to reduced cerebral perfusion, for example, stroke-like symptoms, confusion, and weakness. And finally, hypovolemic shock. That was just a preview. Watch the full video and hundreds more at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today